Good morning. Welcome back to the link. It is 7:44. We're going to head straight into the Zoom room to talk with our good friend, Mr. Dr. Hoa
Mr.
Nguyen.
Doctor.
Mr. Dr. Hoa Nguyen. Good morning, Doc.
Good morning, guys. Good morning, everyone.
Doc, so I guess we just want to kind of start with the booster shots, right? Are you guys getting a lot of calls at the clinic level?
Yes, we have a lot of call, and we started to give out the booster for Pfizer about 2-3 weeks ago, and now that Moderna and J&J are on board, we're gonna have a lot more requests. We're gonna start without some outreach clinic, especially for the staff for the school. So right now we work with the private school to have an outreach for all their staff probably in the next week to 10 days or so. And then if anyone that would like for us to kind of provide the booster shot for their staff, they just ask, give us a call. And if it's a big number, we're just going to put an outreach for your company. But it's important, I think that as we know that the vaccine are kind of weighing off on the about 4.5 to 5 months or so. So I think it's very, very important now for us to go through this pandemic that we need to get our people to come out and have the booster. Again, Moderna and Pfizer is 6 months and over, and then J&J. It's very important for people to have J&J to come out and get the vaccine, the second shot, if it's over 2 months already, which we have a lot of people over 2 months. So you can come out and get another second shot of J&J, or you can cross over to mRNA. So FDA kind of approved for you to mix if you wish. So if you want to do that, we can mix.
What are you hearing though from people, like when they want to mix? Which combination, which cocktail, if you will, would you recommend? Let's say in here, like I'm Team Moderna.
I'm Moderna.
Jason's Moderna. Bree?
I'm Moderna.
Yeah.
Yeah, I think that there's not really a lot of firm study out there for mixed vaccine from one to the other, but the few that come out there show that the response are a lot better if you mix. Moderna seemed to be a lot more resistant to any breakthrough than the Pfizer does. But again, it's because we have a bigger Pfizer population in Guam. But I think that there's nothing wrong with you mix over to another mRNA vaccine. There's nothing wrong with that. So if you want to stay the same, or you can mix. But the most important thing is get your booster. If you have 6 months or over, or if you have a lot of comorbidity and high risk, your physician can give you before the 6 month mark.
Doc, what about boosters for pregnant women?
Pregnant women, we really fully support the booster for pregnant women. We push, and I know that Dr. Shea and a lot of our physicians are pushing for the immunization for pregnant women on the second or third trimester. First trimester, we were thought, I know that it's approved out there, but we were thought that in the first trimester, a lot of things can happen. So, we can delay the booster or the shot, until the second or third trimester. But if people insist to have the first, just need to know the risks, and then you can do that. But, we kind of first trimester pregnancy kind of sacred for us.
Yeah, it was interesting because I was watching YouTube last night, and this video advertisement came on from the governor's office, and they had one was a mother with a newborn, but she was talking about how she had got the vaccine, but it was after she had given birth. So I thought that was interesting.
The pregnancy is considered high risk. Just like during pregnancy, we really push for the influenza vaccine on the second and third trimester. So during pregnancy, again, we're pushing to get it during the second and third trimester. And a lot of studies show that even after you give birth, if you have the immunization, that there's antibody in the breast milk to protect the baby. So again, it's very important to have pregnant patients talk to their physician and get the vaccine as soon as you get to the second trimester. I know the few physicians will give the first, but at the AMC we pushing for the second trimester and the third.
Yeah, it's really interesting to me that Dr. Shea had come out with a video basically encouraging pregnant women to get the vaccine when I know a couple months ago there was a WhatsApp message circulating from him that talked about connection with getting the vaccine and miscarriages. So was it just did he do some more research or something, and is that what led to the kind of the 180? Do you know?
No. He's always, his point is that, there's a higher risk of miscarriage in the first trimester if you have vaccination in the first trimester. But he always supports, vaccination the second and third trimester. He just have quite a bit of case that the first trimester that there's a miscarriage. So he recently documented really well on the website for CDC. But so yeah, from the beginning, he's always supported on the second and third. He just see a lot of negative incidents on the first trimester. So that's from the beginning. So, but no, he's pushing for the vaccine from the beginning. Guys, so again, it's very important to protect the pregnant patient and the fetus. So, and the second and third is always safe to have.
The approval of the younger kids to get vaccinated, it looks like it's coming rather quickly, maybe even by within this week, right? So, what advice do you have for parents of these 5 to 11-year-old as they kind of contemplate whether or not they should have their child vaccinated?
I tell you, for the children from 5 to 11, we really need to push for that because children from that age can be an asymptomatic carrier, and some studies show that they are the one that carry the virus to the family. So the good part about it is that the children at that age, they don't get that sick, right? I mean, we talk about the MIS that we have, the syndrome we have for children of those age, but those are still rare. But most of them are fine. But the problem is that they can be the carrier to the family and to the elderly. So it's important for kids to get vaccinated once it's coming out. It's very good. Pfizer expect to be in the next 10 days or 2 weeks or so to be approved, and so is Moderna. So I would say that parents, just get ready. For AMC, we will try to put out some outreach clinic there to try to get the 5 to 11 to be vaccinated as much as possible. Because again, that is to protect them in school, right? Kids are in school face to face now, so it's very important that they go to school safe if they get immunized, and they can play sport and all that kind of stuff. So I encourage the parents to be ready once that they roll out the vaccine for 5 to 11 to get your children out there and get them vaccinated.
Do you have any information like the side effects that they could experience?
The one that people talk the most is the myocarditis. It's inflammation in the heart in the young, especially in the male side, more than female. But again, everything you do have a risk and benefit. The benefit for having the vaccine protected children is really, really outweighed the risk. And myocarditis is very, very small percentage. It's not anything that alarms the CDC or the FDA to do not approve it. So the safety profile for the vaccine are very, very high. But again, it's about 91% protective for the children at that age. So, we have the holiday coming up, and there's a lot of family get together, and we really have to make sure that our family, including the children from 5 to 11, to be vaccinated. So that way, the entire family are much safer. Again, vaccination doesn't mean that you will not get the virus. Okay, we gotta still push the message out for people to know. They still get the virus, but the severity of the illness and the chance of hospitalization and deaths are much decreased. So that's the really reason why we have this thing. So get vaccinated to protect your family and try to not to lose anyone.
Doc, how crucial is this booster effort? Because we're continuing to see the triple-digit cases. We're still seeing the deaths, but with the booster, from some of the data I'm reading, it drives your efficacy and your protection against the virus somewhere upwards of like 90%, right? So
Yes.
it's November now. Do you anticipate that if we have an aggressive booster shot effort, and also when the kid shots are ready, an aggressive effort in rolling that out, is there a chance that we could have a Thanksgiving or a Christmas?
I think right now Thanksgiving in November, right? So I think past Thanksgiving, that's what we're looking for. If we have a very aggressive booster campaign out there and people out there and get vaccinated, I think we can shoot for Christmas, New Year, and hopefully a much better where we are right now. And that's what we're hoping. Again, besides immunization, people need to kind of social distance and again pay attention to the symptom. If they're sick, go get tested. That's very important. Testing play a very big role to control pandemic. So if you have symptoms, go get tested. That way you can protect your family and not pass your family, your colleague. So there's a multi-pronged approach here. Immunization is one. But again, recognize the symptom, go get tested, so that way you can isolate yourself away from your family. That's one of the most important thing that we can do at this point is really recognize the symptom and go get tested.
Doc, we had a comment here. What's the dosage? Is it based on the child's weight? Is it the same dosage for everybody? It's like a little baby half dose or something, right?
No, the dose for the children are much, much less. I think that half or a third to a dose of the vaccine. So the children, I hope the needle is smaller too. So, but it's going to be less than the dose we have right now. Even like the Moderna, the boosters is rather 100 micrograms, 50, so half the dose of Moderna. So for children, it'll be less.
So Doc, if we come in to get our booster Moderna, what'd you say? It's 50, right? 50.
Yeah, it's 50 micrograms. It's not 100. 50, it's half the dose.
Can you slide us like maybe 75, just because we're cool?
You'll be fine.
Yeah, Doc. I did have a comment here, a question. Can you ask Doc? You've heard from a number of jurors, and I actually have an uncle who's on jury duty right now. They're summoned to court to be part of a 4-week trial or any trial that lasts weeks. 7 to 8 hours a day, lots of older people, some unvaccinated. Is that safe for anybody? Can that many people be kept in a room for that long and then going home to their families each day and returning to spend the day enclosed in court as a group? Is that recommended? What are your thoughts, Doc?
I think that even in the enclosed environment, I know the juries can be a long, long day for everyone. I never been there, but I heard a bad story about it. But, if they have social distance, they wear their masks in the room, that should be safe. And that's the part is that, they got to sit down, to see at least 3 to 6 feet apart and make sure they use their mask. And they do that, they are safe. Again, I don't know the situation in the jury room, but those social distance and masks should be mandatory.
Doc, are you hearing anything about the CDC visit?
I understand that you're going to get either they here already yesterday, so they're going to have a lot of investigation, right? The main thing is they're going to be here is look at the DOA. And we really need to look at that because we cannot afford to lose people without knowing why and without knowing how to improve. So I think that's a challenge. And should look to see why we have so much DOA. And also, I know they listen to this. They're going to be asking is that why we have such a high positivity rate with our high vaccination number, right? So that's something that I'm really everyone would. To hear from CDC just to find out what's going on. It's just that if something that we can improve for our pandemic to go forward, we really need to know. And again, we really appreciate for them to be here. It's never hurt to ask somebody, and never hurt to see we can improve ourselves, because this is the health of one.
Doc, if someone got their second Pfizer shot less than 6 months ago, can the individual get a booster of a different type of vax?
Really depend on the physician. Sabrina, I mean, if they come in, let's say they have multiple risk factors, especially if they have cancer and chemotherapy, and no, they don't have to wait 6 months. They come in, let the physician know, they compromised. We give to them, as long as 28 days after the second dose, we can give if we feel like they very much at the high risk. So if they're Pfizer and they come in, with those conditions, and if they want Pfizer for the booster, we give. If they want the cost of Moderna, we give. Really, it's the call of the patient.
Right on.
I forgot.
But
Yeah.
Get out there and get the booster. We really need to have the holiday coming up when we need to protect everyone, protect yourself, your family, people around you, so we can go shopping and
Are you
have
sure,
fun.
Doc? Because we heard this before with the vaccination. But so this is it. We get the booster, new normal.
Yeah, we hope. I mean, that's the best way we can do, right? I mean, we know the vaccine are waning off, so it's a time to recharge the immunity. Again, we will watch and see if it's truly this recharge immunity will get us somewhat decrease and curb this positivity that we currently have right now.
Yeah.
We still see in the clinic a lot of positive, but it's not as bad as about 4 weeks ago. So the number should go down. It's just that I wish it go down a lot faster than it is right now.
What do you make of the numbers? Are we doing pretty good with people getting their booster shot? So we have 123,017 fully vaccinated. Then you have maybe about 8,000 or so that have gotten the booster. Is that a pretty good number? Are we doing all right, or do we need to make a bigger
I think we can go a lot faster. I think people. I think the people need to come in, and I think that public health and the clinic and the guard, everyone that do the outreach, should kind of relax the rule a little bit. Like I say, I mean, I still hear a story that people come in a week to 10 days earlier than 6 months and was turned away, and that's I would give to them. I mean, the chance they're there already, you turn them away, they might not come back for another few months.
Yeah. No.
But no, I wouldn't follow the rules so strict. I would give to them.
Yeah, Doc. I mean, their own data says it's 4.5 months after receiving the vax that we've seen the positives, right? So yeah, that's interesting. Doc, thank you.
I mean, it's not this. You don't have to wait for 6 months. They walk in, I would give to them. I mean, now a week, 10 days earlier than 6 months, it doesn't mean much. Just they're willing to protect themselves, and that's what we're pushing for. It. I just give to them. I mean, relax the rule. That's the rules make, but you need to bend some.
All right.
Thank you, Doc.
Thanks, Doc.
Okay, give me the list. I get you guys.
We got it. Remember, give me that 75 micrograms.
I want the small needle.
He wants the Lancet.
Okay.
Thanks, Doc.
You're welcome.
All right.
Take care.
Good morning. It's 8:01. Hi. This is the link. Are you guys ready? Are we going on the TV of KUAM today? Yes, we are. Okay, let's jump on.